Well, in this video, I want to take a look at the triple E, or the Eastern Equine Encephalitis virus cases, the surge of cases that we saw this year in 2019. And if you look at the upper right-hand corner, we have some numbers. And it says, as of December 3rd, 2019, CDC received reports of 37 confirmed cases of Eastern Equine Encephalitis virus disease this year, including 15 fatalities. Now, 9 states reported human cases, with Massachusetts and Michigan reporting the most, with 12 and 10 respectively. 37 maybe doesn't mean a lot to you, but if you compare it to just even recent history, it is quite a bit. And let's go ahead and take a look. So here's a bar graph of the past 10 years prior to 2019. So we got 2009 to 2018. And the highest you saw in any individual year was in 2012 with 15. And the average number of human cases during the past decade has been 7. So what we saw so far in 2019, and I assume that may be coming to an end, is about, 5 times what you normally see in the United States. And if we go down to this other chart, which is very interesting, and it tells us how serious this pathogen is, and we're going to talk about symptomology momentarily, but as far as the triple E cases and deaths reported to the CDC each year, and so we're starting at 2009, going to 2018, and we have a total over that decade of 73 cases of human Eastern Equine Encephalitis. Now, this, of course, does not include all the animals, birds, mosquito pools, and all that. The human cases, 30 were fatal, with a case fatality rate of 41. So very, very serious pathogen we're dealing with here when you talk about triple E. And and I've talked about this on previous videos, but just as a reminder, so people understand, and it really segues into the next slide that I'm going to go over, concerning the symptomology of Eastern Equine Encephalitis. There's an incubation period, right? The time when you get bit till you start showing illness is about 4 to 10 days. Triple E infection can result in systemic febrile illness or neurological disease, which could include meningitis or encephalitis. And the type of illness will depend on the age of the person and other host factors. Now, there's some patients that are totally asymptomatic. They don't show any symptoms. So you do have that spectrum. Systemic infection is characterized by fever, chills, malaise, joint pain, muscle pain. The illness will last about 1 to 2 weeks. Most people recover completely when there is no central nervous system involvement. When there is neurological disease, you can see fever, headache, vomiting, diarrhea, seizures, behavioral changes, drowsiness, and coma. And about 1/3 of all people that are infected with the encephalitis due to triple E will die. So it's a very serious disease. And sometimes death will occur quickly, within a week or so. Other times, there may be long-term care involved, severe sequelae, and then death may not appear for 2 to 3 years. So it really varies with this disease. And that really segues me into this video that I found out of a Jacksonville news source, and it's about a Navy sailor stationed in Jacksonville who contracted triple E 2 years ago, and he's still battling the disease to today. So let's go ahead and take a listen so you can get a feel for how this could affect a survivor of triple E.
Mosquito bite put a local sailor into a coma. Tonight, he's relearning how to talk, but he shared his battle with an illness that almost killed him and the signs you need to know to spot.
It's a simple command. Big Hank is learning to obey it.
Navy Chief Bob Stearns is relearning how to say it, but he is already defying the odds. 2 years ago, Labor Day weekend, Stearns went golfing with some Navy buddies. The mosquitoes were out. The next day, he told his wife Jolly he felt dizzy. 2 days later, she rushed him to the hospital and he stopped talking.
I just started to panic, like he was fine. You know, 2 days ago he went golfing, he went to work, and then he got sick. We just thought he had a headache, he caught something.
He was running a fever and doctors put him into a coma to protect him from whatever was attacking his body.
He was unable to talk, unable to communicate with us. And
you were losing your husband right there.
Yeah, like right there. It was just like, does he know I'm still here?
Stearns was in St. Vincent's Hospital for a month. Doctors eventually figured out it was Eastern Equine Encephalitis and a tiny mosquito that nearly killed this big Navy chief.
Even though...
Okay. Now, one thing about Triple E that's important is, and I didn't really think about this until after I saw an article that I'm going to talk about momentarily, is it is a select agent. And that's going to present some problems concerning research on these organisms from this year. What is a select agent? Well, according to federal law, it requires the Department of Health and Human Services, or the HHS, to establish and regulate a list of biological agents and toxins that have the potential to pose severe threat to public health and safety. Now, some select agents are just for humans, some are for animals, some are for plants, and then there's some select agents that overlap. They could threaten both humans and animals. So select agents are these very serious pathogens that can cause a lot of issues in the public health realm. What does that matter? Well, it matters because here's a list of the select agents. And you can see here, as I got highlighted, Eastern Equine Encephalitis is on that list. So that really takes me into my last slide in this last article, which was one of the better articles I've read in recent weeks. And it was out of Stat News. And they looked at something that really nobody else was looking at. And the author titles the article, "Why the Huge Surge in Triple E Cases?" Good question. What made 2019 so much different from, say, the past 10 years, right? However, they point out in the title, federal rules requiring quick sample disposal mean we may never know. So what the author writes is, the massive surge in cases of Triple E this fall has raised urgent questions about whether the dangerous virus has changed. But federal regulations that are leading most states to quickly destroy any positive Triple E samples they find will stymie future efforts to come up with any answers. And this is concerning some experts in the world of arbovirology. Now, the World Reference Center for Emerging Viruses and Arboviruses has been trying to amass specimens from this, though they are calling it an outbreak, this year's Triple E outbreak, to put in a repository. So researchers from anywhere around the world can draw upon this virus and do research on it that may come up with important stuff concerning pathogenicity and virulence and other issues concerning the virus. However, Triple E has been deemed a select agent, as I pointed out to you just a moment ago. And most state labs that find the virus in specimens, whether it be from mosquitoes, birds, mammals, right? Eastern equine, so horses, there's other mammals too, and humans. By law, they have to destroy the material within 7 days. And only labs that are certified to handle select agents can retain it past that time. So the 7-day limit is causing an issue for this repository. They're not able to get the samples for future research. And other issues that go along with this, you have the 7-day limit, but also when you're trying to transfer a select agent from one facility to another, it's quite expensive. And it's a lot of paperwork, a mountain of paperwork, as the author writes in this article. Even though the reference center, which is funded by the NIH, will cover the shipping costs, most labs in states dealing with Triple E this fall have been unwilling or unable to take on the extra work, according to Dr. Scott Weaver, the director of the repository. He says, during the past month or two, we've reached out to all the major state health labs where these cases are being detected, and only one of those has been willing to send us any samples, and that was New Jersey, he says. In the middle of this emergency situation, the last thing you want to do is worry about spending half your day shipping out a sample. It's a huge hassle for them. So that these federal regulations are becoming a hindrance to future research on this very unusual Triple E season. Now, there's ways to get extensions on a case-by-case basis and some other ways around it maybe, but mostly it's pretty written in stone and you got to follow these rules. So the problem is that as Shannon Rossi, associate professor of infectious disease virology at the University of Texas Medical Branch, says, the reality is at this point, many of this season's samples have already been destroyed because of the rule. She calls it a scientific tragedy. Within a couple of years, we're going to look back and wonder why we didn't have the samples to try to figure out what was going on at that time in 2019. Once they're gone, they're gone. Now, some state labs may be able to do some research on their own if they have the select agent certification. Massachusetts, apparently, according to this article, may be doing that. But it's very, very important. So because of this rule, these samples are destroyed very, very quickly, and they won't be put into this repository where they could do things like, comparing the viral sequences and allowing scientists to work on pathogenesis, on virulence, on transmission, and other questions that may not be answered at this point. So really a bad thing, right? A bad thing as far as research and learning more about this disease. But that is the federal law. And anyway, I just wanted to bring that to your attention because we did have a very unique year concerning Triple E, particularly in humans. So again, a hat tip to Stat News for doing this incredible article. Anyway, that's about it I'm going to have for Triple E probably in 2019. If any more cases pop up, we'll take a look at it on the website, outbreaknewstoday.com. But in the meantime, I hope you enjoyed the video. Please comment below and share it with your friends. Let's get the word out. Let them know that these types of videos are available. Like the video and subscribe to the channel. And I'll see you next time on Outbreak News TV.